Privilege requests begin in a new status and stay that way until all required documents have been received. Then the privilege request is moved to administrative review. Here, a team member in your organization will validate that each document provided included the content your organization requires. Once all the documents are approved, the request is automatically moved to board review. Board members are notified of requests to review, can see all details of the request, and can approve or decline the request. The provider privileging application automatically creates a task for approved request. Your organization can configure additional automations to create team-specific efficiencies. To start a new privilege request, navigate to a practitioner contact record and select the Privilege Request button. Select the facility where privileges are being requested. Then select all privileges this provider is requesting at the selected facility. Confirm your selections to proceed with the request. Now you can view a summary of the privileges requested and all documents required for the privilege request. If the same document is required by multiple privileges, it will only be requested and collected once. I've selected to start uploading documents now. Select the first document to upload and follow the prompts to submit the file. Select Add another document to continue uploading files. With 2 of the 3 required documents uploaded, exiting now lets us evaluate the data created before administrative review. The request workflow will automatically create records for Health Cloud objects, Healthcare Practitioner Facility, and Healthcare Provider if proper records do not already exist. Additionally, a case hierarchy is created that includes 1 parent case for the request and 1 child case for each privilege type requested. In this example, Beth Green requested 1 admitting privilege and 2 surgical privileges, resulting in 2 child cases being created. Navigating to the child cases, you can see 1 requested admitting privilege and 2 requested surgical privileges. From the case, you can view the same documents list shown earlier on the contact record. When ready, select Assign Privilege Documents to continue uploading required documents. In this example, I have 1 document remaining to upload. Then follow the same steps we used earlier. The case is automatically routed to administrative review since we have just provided our last required document. The Administrative Review tab of the Provider Privileging home screen lets an administrative reviewer know exactly what requests are ready for their attention. The reviewer can select a request case, view the privileges being requested, and navigate to the included documents. The reviewer can review each document to ensure its contents align to your organization's standards. If so, the reviewer can update the status to accepted. The case will automatically move to board review once all documents are in an accepted status. Any other child cases that were part of the same request will also move to board review, as document requirements are defined at the request or parent case level. If Privilege Review Board members are added to the board review queue, then they will receive notifications each time a new privilege request is ready for their review. Board members can also see their queue of work via the Board Review tab of the homepage. When a request includes multiple privilege types, admitting and surgical, for example, separate cases for each type enable the review board to approve one and decline the other. Similar to administrative review, board members can see all privileges requested within the case and are able to easily access documents submitted with the request. Once their review is complete, a board member can navigate to the Approval tab to approve or decline the privilege request. Doing so moves the case into a closed status. There are likely several organization-specific steps that are required after a provider has been approved or declined for a privilege at one of your facilities. Your Salesforce team can use the case status change to initiate workflows of their creation to support any organization-specific steps. The provider privileging application includes post-approval actions on its homepage and one automated task. The application created a record in the Healthcare Practitioner Facility object when the privilege request was first received. This indicates a relationship between the practitioner and the facility. However, the record was not activated at that time since the privilege approval had not yet been granted. The provider privilege application automatically creates a task for review of this record upon privilege approval. This enables your team to activate the relationship with the proper effective date and details. Thanks for watching. We hope you enjoy provider privileging on Salesforce.